A very good afternoon to everyone present here. At the outset, I would like to thank AIOS and APAO for giving me this opportunity to present my work on refractive and visual outcomes of Smile Pro with Visumax 800. The world of refractive surgery is headed towards flapless surgeries, the advantages being it's less invasive, there's reduced incidence of dry eyes because the corneal nerves severed are less, there's lesser induction of higher order aberrations, the corneal biomechanics are preserved, and it's a single-step procedure that helps enhance the efficiency. So various procedures available with different platforms are all labeled under the umbrella term of KLEX now. So Smile Pro by Visumax 800 is a second generation femtosecond platform that was introduced in 2023. The main advantage being it has a higher pulse repetition rate of 2 megahertz that helps in creating a shorter treatment time of less than 10 seconds, with added advantage of central aligned system for centration and oculine system for cyclotorsion aid. I would like to mention that I do not have any financial interest to disclose. Its procedure, that is Smile Visumax 500. The other procedures available are Smart Sight by Schwind Etos, Clear by Zimmer, and Silk by Johnson & Johnson Elita. Upon literature review, we did not find many Indian studies that are giving the visual outcomes of Smile Pro Visumax 800, and our aim was to assess the same and add to the existing literature. We included 60 eyes of 30 patients above age 22 with compound myopic astigmatism and a spherical equivalent of -4 diopter sphere plus or -1.9 diopter sphere with a maximum spherical error of -7.5 diopter sphere and a cylindrical error of 2.5 diopter cylinder. The corneal thickness was normal in all the patients. We measured the residual stromal bed to be about 300 microns and a normal topography. We measured the outcomes at 6 months and found the residual spherical equivalent to be 0.41 diopter sphere, with 91% of the patients achieving vision of 6.6 or better, and the spherical equivalent to intended target, 71% of the patients were within 0.5 diopter sphere and 100% within 1.0 diopter sphere. The pre-op higher order aberrations decreased post-Smile Pro from 0.24 to 0.187, and the patient subjectively did not complain of any incidence of dry eyes, glare, halos, or blurring of vision. One complication of suction loss during lenticule creation occurred, which was converted successfully to femtosecond LASIK. Upon comparing our results with other procedures and the latest article by Ganesh et al. On Smile Visumax 800, we found that the visual outcome is comparable to all other studies, the major advantage being the laser and suction duration time, which was significantly less. The take-home message is that in an era where patients are demanding, there are more published literature and comparable reviews are required so that we can offer the best choice to our patients. Thank you.
Yeah, excellent, Dr. Avani. So I would like to ask you, when are you getting your Smile Pro done yourself?
Ma'am, to be honest, it's a priority thing. I absolutely had never had any problems with my specs. They do not even come into my view in day-to-day life. If it would have been a problem, I would have gotten rid of them.
So what do you think is the advantage of Smile Pro over the, like Visumax 800 over Visumax 500?
So Visumax 500, the docking time, the laser time, both are more. It's around 30 seconds. And other than that, the review that I did, the visual outcomes are absolutely comparable. The only difference is the laser duration time.
Okay, so what's the advantage of that if you are having Smile Pro?
So
in which conditions?
Smile Pro has a
High power.
visual outcome is the same, to be honest, but high power for high refractive errors. Maybe Smile Pro.
Duration has to do something, no?
Do you think that would reduce the incidence of post-op dry eye or complication, immediate post-op?
Yes, sir, definitely.
It does.
Yeah.
Why should it do it?
So that.
Why it should have lesser chance of dry eye?
No.
Okay, thank you. It was a nice presentation. The only thing I want to tell you that you can go through it. I mean, you all are students only. You can always think about what is the advantage of the smaller time, in which conditions, wherein you can have the advantage of this smaller time.
Off the hand, only glaucoma is the thing I can think about.
One. Yes.
Other than that, uncooperative and anxious patients.
Yes.
That's it. I can't think of any other reason as of now. Yes, sir. I'll go through it, sir.
So you do take patients of glaucoma for Smile Pro, is that so?
Sir, not. We haven't taken any patient till now. Yes.
Okay, thank you.
Thank you, sir.